Hi, my name is Alan Fenstermaker, and I'm here today to give an instructional video on how to perform CPR. CPR is cardiopulmonary resuscitation, and when you're doing CPR, protocol states that you do 30 compressions of 2 breaths, which equal to being 100 compressions per minute. And you want to check for a pulse in the carotid artery for anywhere from 5 to 10 seconds with no longer than 10 seconds. And also, they changed the protocol as well from ABC to CAB, which means compressions, airway, and breathing, because that's mainly stating the importance of compressions and the fact that if you don't feel comfortable giving mouth-to-mouth resuscitation, you could always just do hands-only CPR, which would just include compressions, which I will show you today, as well as use of an AED, an automated external defibrillator, as well as infant CPR as well. Okay, now what you want to do when you're doing CPR, first of all, you're coming across a patient or a victim. You're coming across a victim, and all right, here's a scenario. You're walking down the street and you see a person laying there, and they're unconscious. You go over, "Are you okay? Are you okay?" You tap and shout, and then what you do is you want to make sure you check for. Okay, you're walking down the street. You see someone laying there on the ground. The person's unconscious. You tap and shout, "Are you okay? Are you okay?" Check to see if there's a pulse. Always check for the pulse on the same side that you're on. You never want to reach across. Always check it on the same side as you. Okay. Then what you're going to do, if there's no pulse, you want to remove the shirt so you can line up hand placement on top of the breastbone in the lower part of the sternum. And you want to start compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then after you do 30 compressions, there's this is a device called a pocket mask. It's pretty easy, and it also cuts down on disease transmission. It's a one-way valve, so it prevents from disease, or also if the person should vomit when you're doing CPR. This prevents from you getting vomit on you. What you do, take the mask like this. You want to point the nose up towards the patient's nose. Get a tight seal. Deliver 2 breaths. You want to make sure the chest rises, and then so that you can make sure that the breaths are going in. If the breaths don't go in, you want to retilt the head, give 2 more breaths. And then regain compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 more breaths. Okay, compressions again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths. Okay, then an AED comes on. What you do for an AED, first of all, you want to make sure that the person's not wet. If the person's wet, you want to dry them off. If the person has a lot of hair on the chest, what you want to do is you want to take one of the AED pads. There are special AED pads, some for kids and for adults, or an AED sometimes also has a pediatric switch as well, or a key. Now, if the person has a lot of hair, you want to take the patch, put it on top of the spot, and then rip the hair off. Or some AEDs come with a shaving kit that you could use to shave the chest, so that you could get an adequate shock. So what you're going to do is you're going to apply the pads, one down on the lower part, and then the other one you're going to apply up here. the upper part of the chest. Also, you want to make sure that there's no pacemakers, medicine patches. If there's a medicine patch, you want to remove it. And then if there's a pacemaker looks like a deck of cards. So what you want to do is put it below, so you don't have it close to the pacemaker. So then what you do then, this is the actual AED. First, you want to make sure to turn it on.
Apply pads to patient's bare chest. Plug in pads connector. Analyzing heart rhythm.
Okay, everyone clear? Stand clear?
Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered.
Okay, make
Begin
sure,
CPR.
again, before you hit the button, make sure everyone's clear, and then you begin CPR afterwards. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 more breaths. And you want to keep doing breaths and compressions until the AED were to tell you again, like to stand clear. Then you want to make sure everyone clears the area, or you don't want to touch the patient when the AED is analyzing, because if the AED is analyzing, you touch the patient, it could pick your pulse up as a false reading. Or just like you don't want to be doing compressions, because that could cause the AED to think the person has a heartbeat when they don't. So you want to make sure that everyone. Now the next thing will be child CPR. Child CPR is pretty much the same as adult. You do the same amount of compressions, the same amount of breaths. Just the only difference is you're using one arm. Now, like if the child is big, like kind of like a linebacker type, then what you would do is then you would use 2 hands. Or like if you can't get adequate compressions done with 1 hand, then you could do 2. Also, 1 arm would be also for like an elderly person that's small in stature. So pretty much what you're doing is you're putting the pocket mask on the same way, and then you're going to do compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Also, you always want to remember to call 911 to get help in there fast. That's another reason why you want to count out loud, because when EMS personnel arrives, that they'll hear you counting out loud, and because they hear you counting out loud, they'll know where you're at. Okay. Now, next thing, we're going to move on to infant. All right. Say you're babysitting, and you see the kid that you're babysitting is laying on the floor and appears unconscious. What you do is you tap the foot. Baby, are you okay? Are you okay? Quick, call 911. Okay. Then you analyze you check for hand position for CPR. Use 2 fingers. Put the 2 fingers on top of the breastbone, just below the nipple line, and then with the pocket mask, you want to put the nose part down. Okay, so it's the opposite direction for the pocket mask than adult. You want to get a tight seal on the pocket mask too. Start compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths. Also, remember on an infant, you always want to check the pulse on the arm, the brachial artery, which is right here.